Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working in Francisco Kidney Medical Center in Singapore. Welcome to the Kidney Health and Disease video series. Today is the time for the 9th video of the series, that it is how to protect your kidneys. Before starting, I need to say that the aim of this video is to create awareness of kidney problems and to give you more elements to discuss more effective care and prevention plans with your doctor. In order to modify your lifestyle and diet more effectively, this general advice needs to be tuned to your personal condition on your doctor guidance. This is a general advice given in good faith. Blood pressure control is probably the most effective measure to protect your kidneys, and also is easily achievable with lifestyle modifications, diet, and medications. The correct target for you need to discuss with your own doctor. But typically, doctors prescribe medications to achieve less than 140/90 or less than 130/80. Blood pressure control is important because high blood pressure damages directly the filtration units of the kidney, the glomerulus that we already spoke about it. Irrespectively of you having only high blood pressure or having any other medical condition like diabetes or inflammation of the kidneys, because this damage will be additive. Avoiding salty food is one of the ways that also you can use to control blood pressure, either avoiding it or minimizing it, because salt worsens blood pressure, fluid retention, make the heart overwork, etc. I would recommend you to buy a blood pressure machine and monitor your blood pressure at home and take records. With this, you can even detect when your blood pressure is going high, rather than waiting for 3 or 4 months to discover it when you go and see your doctor. You can approach your doctor earlier and prevent some damage. Otherwise, for those 3 or 4 months, your kidneys and many other ones were subjected to high blood pressures. But in addition, by monitoring blood pressure at home, you can detect the so-called white coat hypertension, by which patients can have high blood pressure when they go and see the doctor, but at home the blood pressure is okay. In those scenarios, typically, you don't need to increase the antihypertensive medications. Otherwise, you are at risk of causing low blood pressure because at home the blood pressure is normal. Smoking is probably the most nauseous thing that humans can do voluntarily and legally to themselves. Stop smoking. It will be very beneficial for your kidneys and many other organs and your health in general. It is not easy because indeed nicotine is addictive, but there are many programs around that then can help you to quit smoking. And not only your lung, your heart, your blood vessels are affected, you also have chances for more cancers, etc. But also the people around you are affected by you smoking. If you have children and you smoke around them, they also are breathing those fumes, and they are toxic to them, or to your spouse, or anyone around, to your friends, etc. So this will be if you are smoking, considering quitting smoking will be very beneficial for you and for your health and for your family. Doing exercise is very important to maintain a strong heart, strong muscles, can also make your mood better, reduce stress, can make many of your metabolic processes work better in your body, improve blood pressure, improve your lipid profile, make you a little bit resistant to developing diabetes. So doing exercise is very important and can help you maintaining weight and also make you look into a better shape. So there are many beneficials of doing exercise. And in occasions you can also lose weight. But in order to lose weight, diet is probably the best and most effective method. Exercise will help you, but selection of a healthy and balanced diet will be ideal. But it is very difficult to keep because everyone likes his or her own food. But the secret is to identify what are those extra calories that you don't need. Typically, are found in snacks or selecting too much oily or fatty food over other types of food, fried food over steam, etc. So the first step probably is identify where are you getting your extra calories. And then later, not necessarily remove them. If you can, good for you, because frugal diets are the most healthiest. But that's the healthiest. But if you cannot do it, that you are like most people, at least minimize them. And my advice to minimize them is not by stop them. If you can, again, you can do it. But is by reducing the amount of the portion, the number of portions, or the frequency of the portions. For example, if you identify that you eat 2 muffins a day, then now eat only 1 muffin a day. And then you're giving your treat and you're reducing the calories that you don't need by 50%. If you just eat 1 muffin a day, then just eat half. Or eat it every other day. So in any of those scenarios, you are reducing by 50% the calories that you don't need. That is very effective, and you will lose in probably in a few months at least 10% of your body weight. That is typical, the prescription that can modify with a lot of benefits many of your metabolic parameters in your body. For example, if you have fatty liver, modification of 10% of the weight is advisable, etc. As I mentioned, this will help you if you try to avoid very oily or fatty food, like the ones here, but not necessarily all the Western food are bad or high on this content. There are many food from other places of the world that they are very oily and fatty, even that are full of veggies, etc. So you need to try to minimize those as well, and your cholesterol levels will be also better, etc., and many other lipids. Otherwise, you might need to take medications like the statins or others, but for that you need to discuss it with your doctor. Also, selecting the correct type of foods or reducing your sugars is very important. If you can prefer your sugars on fruits, on natural stuff, is better than on processed stuff. But if you are, I told you that many people that like sweets, is also okay, but the secret is just try to minimize them in the same way I told you before, by reducing the frequency, the amount of the portions, the number of portions, by sharing the portions. But it's okay to give yourself once in a while a treat, but not all the time. So people are not aware that drinks can give you a lot of calories. Many people know about soft drinks, but many people don't know, and even some other drinks that they drink every day that they think are healthy, but they are not so much regarding sugar. So indeed, water is the best drink, but if you like one of those, again, try just to minimize the frequency or the amount of a portion that you, the volume you drink. If you have diabetes, it's ideal that you take your diabetic medications as prescribed to get a good control of the sugar and the so-called HbA1c. For those that want to know, but it's important because your doctor typically, if you have diabetes, talk about the level of HbA1c. You need to know what it is. You have red blood cells in your blood that carry oxygen. The specific portion of the red blood cell that carries that oxygen is called hemoglobin. It's a protein. When you have excess of sugar in the blood, the sugar go and stick into the hemoglobin and form this HbA1c, also called glycosylated hemoglobin, but you can see like a caramelized protein, a caramelized hemoglobin, because there's so much sugar around that just get sticky. So by us measuring in the lab the amount of the sticky or caramelized hemoglobin, we can tell how well was your blood sugar control in the last 3 months. Therefore, we advise you to target a good level that you need to discuss with your doctor what is the correct one for you. Monitoring blood sugar, you have diabetes, is very important, irrespective of the method you use, by finger prick, or you use the novel methods that you can just stick a plaster on your arm and get a ambulatory continuous monitoring without needs for pinprick, and you can do it anytime you want just by a sensor and a detector. It doesn't matter what you use, but it is ideal that you monitor the sugar. If your condition is stable, the intervals that your doctor advise you, but more intensively when there is changes in your diet, changes in medical condition, or changes in the medications. It's advisable that you do more intensive until everything goes back into balance, to steady state again. If you have high blood pressure or diabetes, it might be important to get your eye checked at least yearly or more often, depending if you have already some disease in the eyes, because by doing that you can detect this early and maybe do some measures to minimize the chances of you developing blindness or other related problems. As I mentioned, diet is very important. It's not easy because food is lovely, yeah? However, most patients that choose to go on a healthy diet, a frugal diet, then tend to live longer, and most of the parameters are well controlled. If they have chronic kidney disease or they are on dialysis, over patients that they take less restrictions. But if you are in that group of patients that can live a frugal diet, very well done. You will receive a lot of advantages. But if you are, as many other patients, that is very difficult to control the diet, so you just keep up. You don't need to go also to that extreme, because if you cannot and you try on a very restricted diet, most likely you're not going to follow it, and at the end of the day there's no diet and there's no benefit. So that's why it's important that you involve a dietitian in your care, especially if the dietitian is trying to develop a diet that is personalized or tailored to yourself and to your cultural background, to the available food around you, not just to tell you 60% reduction on that, 50% on that, 1 gram of protein or anything like that. No, you need to know what it means in your daily diet, what you normally eat, and what you need to minimize, or what you can play around according to your palate or your cultural background or your preferences. For that, you would need a dietitian that can advise you in that way. Because indeed, patients with kidney problems, especially if they have more advanced disease or they have already end-stage kidney disease, they need to control their sodium, sugar, and fat, as I already mentioned. But also the potassium that is present in many fruits and vegetables, because the kidney cannot handle well the excess of potassium, and when the levels go very high, maybe even can be as dangerous and put your heart into a standstill. So that's why when your doctor tells you to control your potassium or potassium containing food, is very important. In addition, phosphate control is important, because this can cause a lot of rearrangement in your bones, make one of the glands on the neck overwork, that occasionally the only way to solve the matter is by doing a surgery. A surgery in a patient with chronic kidney disease, end stage, on dialysis, is high risk. So this could be avoided with implementation diet much earlier. In addition, minimization of protein is an important factor to prevent the progression of kidney disease, but it's also difficult, because if the patient is vegetarian or vegan, or can become vegetarian or vegan, they receive a lot of benefits and a lot of benefits on that protein restriction, because proteins bring extra toxins to the body, provide extra acid load to the body that is in a way toxic. So if you can live a vegan or vegetarian diet, that's very useful. But if you cannot, as many people cannot, so at least try to minimize, and that's where the role of the dietitian comes into play, to tell you what are the high quality proteins, or how can you swift around the meat you eat to try to achieve some protein restriction that gives you the benefit of the restriction of protein, but also don't preclude you to get proper nourishment and avoid therefore malnutrition. If you cannot control your phosphate with diet, you might need these phosphate binder medications that many patients don't like to eat them, but at least you need to know that it's very important. If you can control diet, you will be able to take less of these medications. So you have the opportunity to take less if you control diet better. But if not, at least take these medications, try to control your phosphate and many other derangements as a consequence of that. There are some studies saying that controlling uric acid is also beneficial and can protect the kidneys, not only the symptoms of gout. You can do this through diet as well, or through some medications that lower your uric acid. The same goes for bicarbonate. Sometimes advisable to take it because your blood can become acidic when you have a chronic kidney disease or kidney failure. So you might need medications that are kind of anti-acid and reduce the acid load in the blood. Water restriction is very important because the kidneys, when they are ill, not only cannot handle properly the toxins, but also water content. And if you overdrink water, as I mentioned in the previous videos, you can develop many symptoms of fluid overload, your heart overworking, precipitate heart failure, arrhythmias, or other problems, or acute pulmonary edema, that is your lungs flooding with water. So it's very important, but it's also difficult. So again, you need a lot of support and strong will to try to minimize water, but it's very beneficial. Also, again, my observation that my patients that have reduced water, they typically tend to do better than patients that are less restricted in water intake. Sometimes we prescribe antiproteinuria medications to patients with high blood pressure, chronic kidney disease, because they act directly into the filtering units of the kidney by reducing the blood pressure at the microscopic level and preventing damage and preventing further leakage of protein. And this leakage of protein can injure many of the structures in the kidney. So if your doctor prescribes medications, try to take them as prescribed. Some patients are not able to take them because they have side effects on increasing the potassium, or sometimes some sort of allergies, or sometimes even increasing your creatinine. So you need to discuss this with your doctors. For some patients with cardiovascular risk factors, aspirin might be useful, but you need again to discuss with your doctors because aspirin also can have some side effects. We mentioned in the previous videos that the kidneys also produce a protein, a hormone called erythropoietin, that helps producing red blood cells. When it is deficient or the patient is anemic, it is ideal to take iron supplements or erythropoietin injections to boost back the red blood cell count to a healthy one. The level of anemia permissible, you need to discuss with your doctor. But if your doctor prescribes medications, you try to take them as prescribed. Healthy people probably don't need to take vitamins through pills. By having a balanced diet, eating different types of fruits and vegetables, they can get the correct need for vitamins. However, patients with chronic disease, they might become deficient in some vitamins, or sometimes with the diet restrictions that we advise on them, not eating too much fruit, vegetables, they might not get the correct amount of vitamins, so they will need to take them on pills. So if your doctor prescribes vitamins, please take them. As well, many patients develop a deficiency of vitamin D, so if your doctor prescribe it, please take them as well. Vaccinations are important for people with chronic kidney disease or dialysis because having high levels of toxins not only affects all the organs we already commented, also affects the immune system. The immune system might not work very well, and patients might be predisposed to extra infections. So one of the ways is to protect you with getting vaccinations against flu, pneumococcus, or hepatitis B, for example, especially you go for hemodialysis to try to prevent the chances of getting this infection if accidentally you get exposed to the virus. Patients with cysts might need to undergo surveillance. For example, they typically do it with ultrasound just for, it's easy to see. I have chosen a CT because in people with chronic kidney disease, if they have cysts, they have a slight risk of with time the cyst can develop into a tumor. It doesn't happen often, but it happens. So that's why it's important when people who has got cysts, especially if the cysts look a little bit awkward, to monitor that with, typically it's with ultrasounds, but the doctor can advise you if another method might be necessary. So if your doctor tells you to go for your ultrasound, just please do it. Moderating alcohol consumption is important, not only for your liver, but also people who drinks more alcohol. Also, the blood pressure is not very well controlled. Typically, no more than 1 drink for women and no more than 2 drinks for men per day is recommendable. But if you can avoid it, it's better, correct? But if you drink once in a while, socially, I think also no major damage. But if it's very frequent, or you binge drink, or exceed that permissible limit, so your liver and many other ones will struggle. So try to do it with moderation if you like to drink alcohol. If you're pregnant, tell your doctor, because you might be taking medications that could be potentially harmful to your baby, so your doctor needs to be aware. Also, you might need closer monitoring, because if you have, unfortunate to have a chronic kidney disease, this disease can progress faster when someone is pregnant, so the doctor needs to give you advice on that and monitor you more frequently, probably. Try not to miss your doctor appointments. This is very important, although, I mean, it sounds very simple, because your doctor can identify problems sometime and can do a manipulation your medications or the advice. Otherwise, you will preclude yourself to getting that chance to catch something on time, or having the doctor advice on modifications and prevent complications. Plus, you can also address many of your concerns that are worrying you, etc. So it's very important. But probably what is more important is that you communicate properly with your doctor, that you get all your queries and concerns addressed, so that you gain some peace of mind and you know what is going on. Because having the uncertainty or dragging those queries, concerns, worries home is not good for your health. Also, tell your doctor when you have side effects of medication. So most of the time doesn't mean that the doctor gives you the wrong dose or wrong medication. It's just simply people can react differently to medications, but he needs to be aware, so he needs to change your medication or advise you differently, or sometimes even stop the medication. So communicate with your doctor, and also communicate with your doctor if you are not responding as you expected or your doctor expected to the treatment or management. He needs to know that. That doesn't mean that what he gave you was the wrong thing. Simply, not everyone responds the same. So, but he needs to know, because he might need to tune that. And it's important that you tell that doctor rather than go for a second doctor and try something totally new. So it's better the first doctor to advise you. Although second opinion is part of human nature, so you can go ahead, but try always first to figure out with your first doctor if something else can be tried. So I hope that you find this piece of advice useful. If so, thank you very much for attention. This is in fact the end of this video series. However, I might include some bonus topics in the future, or I might add it to another series. But I want to thank you very much for going through all this series. Please subscribe to the channel so you stay in tune for the next videos. And if you like this video series, please like the videos, share them with your friends. I'm sure someone around will benefit from listening to all this. And I wish you the best possible health. Take care. Bye bye.